Welcome back on the Good Morning Artesia radio show. I'm Gene. Jeffrey's in the other room. Don't pay any attention to the man behind the curtain. And we are going to continue our conversation with Dr. Joseph Krupa, who is the new podiatrist at Artesia General Hospital. And there's going to be a open house today, I guess in your honor, Doctor, at the hospital. It's going to be, I had it here.
Yeah, I hate to say, it kind of snuck up on me. It's supposed to be 6 to 8 tonight at the podiatry clinic. Also, the wound clinic's going to be involved as well with the general surgeon. It's in Professional Building 3 at Artesia General Hospital.
Yeah, they say Suite 500, and this is intriguing to me, heavy hors d'oeuvres.
Yeah, I don't know what that means exactly.
I don't either. So you'll have to come by and check it out. So, well, tell us for those that may not know, what is podiatry?
So, oddly enough, podiatry, it's been its own sort of like specialty for a long time, kind of more humble beginnings. As of late, we've helped out orthopedics a lot for whatever reason. We get a lot of our surgical training from them, at least at St. Barnabas Hospital. I know a number of other programs. So I was doing elbow surgery, shoulders, lots of hips, pelvises, all those sorts of things too. And then I really honed in on foot and ankle sorts of procedures.
And that's what podiatry is, and foot and ankle surgery?
I mean, leg too.
Okay.
I mean, it really depends on the state. It's very odd because some of the states still have ideas that you should be a hand surgeon too for whatever reason. They're like, okay, yeah, you can have hand privileges in some capacity, which kind of makes sense. There's a lot of bones in the hand, just as there's a lot of bones in the foot. You know, I did take care of a lot of wrist fractures, a lot of kids with wrists, a lot of adults with wrists. I would close, reduce them. I mean, they would basically kid that the wrist is the anatomic, ankle of the upper extremity.
Right. I guess that's so. And one of the things I try to remember from school is that the foot, aren't there more bones in the foot than in any other part of the body?
Yeah, there's like 30-some bones in the foot. There's so many joints. Some of the joints move more than others. A lot of them don't move very much. But then if you think about it, your big toe joint is supporting like the entire weight of your body and then some during certain activities. And it's about the size of a quarter.
Isn't that amazing?
It's pretty demanding. You think your knee is doing a lot of work. Think about how much force is going into that small area.
Sure. So who are the types of patients then that you'll get to see? Are they referred to you, or do people have specific issues that they're experiencing that they need to come and see?
Well, most of the people are referred to me. I'm always, happy to see anyone. I mean, it's the insurance games more than anything. Some insurances are required. You have a referral. Other ones, depending on your plan, you can just be like, I want to see him, and you don't need anyone to say so on it. You just call, make an appointment, walk in sort of thing, and happy to see people.
So, and what are the types of cases then that you get to see or that come to you? Is it that people that have had accidents, they've turned ankles, they've broken bones, or?
Oh, yeah. Definitely a lot of that. But I also see a lot of more routine things too. Corns, calluses are still a mainstay. Nails, especially in diabetic patients. And other people with poor sensation. People that, are in wheelchairs, other sorts of situations that can get them in trouble. And it's, I help keep them out of trouble, help get them better. And, keep them going.
Sure. And what are some of the tools that podiatrists use nowadays? You mentioned surgery, but are there some very unique or specific tools and devices that you get to use?
Yeah, so we've kind of evolved with some of the bunion procedures we do nowadays. There's a particular procedure out there called Lapiplasty. You can think of how the orthopedic surgeon goes in there and he replaces your knee. He uses all these cut guides and other sorts of instruments to line things up precisely. Mm-hmm. This is like the same thing for a bunion. I get things lined up and dialed in precisely with little reduction clamps and little positioners and then these little cut guides and everything, and I make wafer-thin slices of the bone to, keep all the good stuff and just take what we need only at precise angles as well.
Wow. So it just sounds like a very interesting, very precise. You're dealing with small areas and small sections. So I guess you've got to have good vision or vision aids to help see what you're doing.
Yeah, and good 3D sort of like perception and things, looking at scans. I mean, even a couple, like a little millimeter here or there matters.
Wow, that's just that's amazing. So when you go into a practice like this, do you have like a goal or a mission statement, or how do you want people to understand what your goal is as you're working with different patients?
Well, my goal is always to help get the patient better. I want to help keep them doing what they want to do with their life, keep getting around, just keep staying active. And if anything's getting in the way of that, in terms of walking, I'm there to help correct it or help guide them in the right direction to get the right help they need.
Mm-hmm.
Even if it's something like, it's really their back, I can help get them started, kind of line things up from the feet up, help in that aspect. And then if it's still not, quite cutting it, or they're getting better some, depends, whether or not they need to go see the neurosurgeon for some sort of back, opinions, and whether or not they could benefit from some sort of back surgeries.
That's great. Well, we're glad you're here. You said you have a family. Is your family with you here?
Yeah, I've got a wife. We used to have more family members. Unfortunately, the cat passed away on the road coming here.
Oh no!
Yeah.
Heard New Mexico and said nope. I'm done.
Well, my wife kept insisting the cat wasn't going to make it. I was like, no, the cat's going to make it. It's going to make it to New Mexico.
Yeah.
Ming was like, Ming's going to be happy there. It's going to be nice weather. She was like 22, 23 years old. And
wow, that's a long time for any small animal like that.
Really, yeah. It just took a turn for the worst, like right before we moved. And
yeah. Well, that's too
away.
bad. We came out of a grocery store in Roswell yesterday, and somebody said, they were standing by the back of an SUV, and they said, "You want a cat?" I'm like, "No." I don't know that I trust cats out of the back of SUVs in parking lots of grocery stores, so.
Well, friendly people.
Of course, but we'll do that. It also says here on your bio that you tinker. And I asked you before you went on the air, you have a car that you're trying to work on right now?
Yeah, I got to replace the knocking sensor in it, jack it up and whatnot. And then I really, mess around with electronics and computers more than anything.
Okay. That's kind of fun.
Piecing together, I have some models around the clinic that I'm trying to make more, like, anatomically focused replications that people can understand, with, like, making tendons that are recognizable, like
okay.
the Achilles tendon, and then showing how it functions in relationship to the knee.
Well, that's always helpful because you can't see any of that. And
exactly. And then some of the actual models they sell are too, like, anatomic. You get distracted by other things. I want you to focus on, here's the tendon. It's stretchy. It works like this. And here's the plantar fascia. Heel pain. People, if you can kind of hold it in your hands and move it, you can get a better idea. And it's not going to be 100%, one-to-one with the way it's going to stretch, but the whole idea is so you can feel how it's stretching and how it's tight and it's loose in different positions. That's what I'm going for.
So, and hopefully we'll have those about the office here soon as you get those all put together. So.
Yeah, no, I've got all the models. I just got to put the pieces together. The other week I got the bunion model in shape just in time, nick of time.
Yeah. You buy the bunion model the same place you get the model airplanes and the cars, or is that a specialty shop?
All comes from Amazon nowadays.
I know, isn't that crazy?
It is crazy.
Well, it is real nice to meet you. We're so glad you're here. And folks that want to meet you, there's an open house today at, and we mentioned this earlier, it's at Artesia General, Suite 500. You said that's building...
It's Professional Building 3.
Professional Building 3. 6 to 8 tonight, and you'll get to meet Dr. Krupa and the staff, and I think there's even a tour of that particular section of the...
Yeah, the whole clinic area should be open, from my understanding. People can see the sophisticated hyperbarics chambers even, Okay. I don't think they're going to be demonstrating dives, but...
No, that's probably
not.
Hope. Only on the hors d'oeuvres, so that'll be great. Well, thanks for coming in. Appreciate you. Nice to meet you, and I'm sure I'll have foot problems. I'll be seeing you soon.
My pleasure, Gene.
All right. Thank you so much.